Understanding hysterectomy, types, indications, and recovery. Hysterectomy is a surgical procedure that involves the removal of a woman's uterus. It is one of the most common surgical procedures performed on women and can be recommended for various medical conditions that affect the uterus. This video aims to provide a comprehensive overview of hysterectomy, including the different types, indications for the procedure, and what to expect during the recovery process. Types of hysterectomy. There are several types of hysterectomy, depending on the extent of the uterus and surrounding structures removed. 1. Total hysterectomy. In a total hysterectomy, both the uterus and cervix are removed. This is the most common type of hysterectomy and is often recommended for conditions such as uterine fibroids, endometriosis, abnormal bleeding, and certain cancers. 2. Subtotal or partial hysterectomy, also known as a subtotal or partial hysterectomy. This procedure involves the removal of the uterus but leaves the cervix intact. It is usually reserved for specific medical conditions and is less common than a total hysterectomy. 3. Radical hysterectomy. A radical hysterectomy involves the removal of the uterus, cervix, parts of the vagina, and surrounding tissues. This type of hysterectomy is typically performed for gynecologic cancers, such as cervical cancer. 4. Total hysterectomy with bilateral salpingo-oophorectomy. In addition to removing the uterus and cervix, this procedure includes the removal of both fallopian tubes and ovaries. It is often recommended for cases of cancer or when there is a high risk of developing ovarian cancer. Indications for hysterectomy. Hysterectomy is considered when other medical treatments have not effectively addressed certain gynecological conditions. Some common indications for hysterectomy include 1. Uterine fibroids. Large or symptomatic fibroids that cause significant pain, bleeding, or pressure on nearby organs may require a hysterectomy. 2. Endometriosis. Severe endometriosis that does not respond to other treatments may necessitate hysterectomy to relieve pain and improve quality of life. 3. Uterine prolapse. When the uterus descends into the vaginal canal due to weakened pelvic muscles, hysterectomy can be a treatment option. 4. Chronic pelvic pain. In cases where chronic pelvic pain is caused by conditions affecting the uterus, hysterectomy may be considered. 5. Gynecologic cancers. Hysterectomy is a common treatment for certain cancers, including uterine, ovarian, and cervical cancer, especially if the disease is detected in its early stages. Recovery and aftercare. Recovery from a hysterectomy can vary based on the type of procedure performed, the patient's overall health, and individual healing rates. In general, recovery can take several weeks, and patients are advised to follow these guidelines. 1. Hospital stay. The length of the hospital stay will depend on the type of hysterectomy performed. Total hysterectomies usually require a hospital stay of 1 to 2 days, while more extensive procedures may necessitate a longer stay. 2. Pain management. Pain and discomfort are common after a hysterectomy. Doctors will prescribe pain medications to manage post-surgery discomfort. 3. Physical activity. Patients are encouraged to gradually increase their physical activity. Light activities such as walking are usually recommended initially, followed by a gradual return to regular activities over the weeks following the surgery. 4. Vaginal bleeding. Vaginal bleeding or discharge is normal after a hysterectomy and may last for several weeks. Patients are advised to use sanitary pads and avoid tampons during this time. 5. Sexual activity. Sexual activity should be avoided for several weeks following the surgery to allow the body to heal fully. 6. Emotional support. emotional support from friends, family, or support groups can be beneficial during the recovery period, as it may take time to adjust to the changes following the procedure. Conclusion: hysterectomy is a common and often life-changing surgical procedure for women with various gynecological conditions. While the decision to undergo a hysterectomy should not be taken lightly, it can provide significant relief and improve the quality of life for those with debilitating gynecological issues. If considering a hysterectomy, it's essential to have a thorough discussion with a gynecologist to understand the benefits, potential risks, and available alternatives based on individual health and medical conditions. With proper care and support during the recovery process, many women go on to live healthy and fulfilling lives after hysterectomy.